Hi, I'm Mark Poole, going to answer the question, what is an aneurysm? I think some patients think that it's an abnormal connection between a couple of blood vessels or maybe a blood vessel that grew in the wrong place or something like that. That's not the case. An aneurysm is just a blood vessel that's too big, or a blood vessel that has a portion that is too big. Once it hits about 1.5 times normal, or 1.5 times the remainder of the blood vessel for a given patient, then we start to call it an aneurysm. An aneurysm can occur in theory in any blood vessel of the body, but they tend to commonly occur in certain ones. For instance, the most common aneurysm is probably an abdominal aortic aneurysm. In the abdomen, the aorta there commonly forms an aneurysm. We call it a AAA. It can be a common problem, especially in older patients. Another common place would be a cerebral aneurysm, an aneurysm in an artery in the brain. So if you hear somebody that says, oh, my friend or somebody died of a brain aneurysm, they generally mean the rupture of an aneurysm in an artery of the brain. Another place where it can commonly occur is a popliteal aneurysm behind the knee. You can have coronary artery aneurysms, aneurysms of the arteries of the heart. It's pretty rare. But what I see more commonly as a thoracic and cardiac surgeon is aortic aneurysms in the chest. It's a common problem. I see a lot of patients. Autopsy studies would indicate maybe 3 to 4% of the population may have a thoracic artery aneurysm. So it's something we see commonly. The general idea is that they don't day-to-day cause problems. It's basically just a pipe in there. Now, a special pipe that can expand and contract slightly based on the blood pressure, but it's basically just a pipe through which the blood moves and doesn't cause a problem on a day-to-day basis. It doesn't tend to cause symptoms, doesn't not tend to cause chest pain, shortness of breath, or that kind of thing, unless they become very large, in which case they can push up against adjacent structures and cause symptoms because of that. Now, the problem with an aneurysm, if you are looking down the blood vessel, as it gets bigger and the aneurysm expands, then the wall is getting thinner, and eventually it can get thin enough that it could pop or rupture, which is generally life-threatening. And of course, an aneurysm, in as much as it's an artery, is always pressurized. Your blood pressure is never zero. It may be 120/80, right? That 80 is at the point of relaxation. It's still 80 millimeters of mercury. So there's always a pressure inside those blood vessels, which tends over time to cause them to enlarge. And it's something that, if you know you have an aneurysm, it's worth keeping an eye on to see how big is it getting. Not every patient with an aneurysm needs a surgery, but some may. And so it's something to seek advice from your doctor if that's something either in your family history or something that you found on a scan or something like that. So when it comes to complications of an aortic aneurysm in the chest, be sure you check out my video about rupture and dissection to know when that may be something that you need to be concerned about.